first aid for epilepsy and what are the do's and don'ts in patients with epilepsy?
See, first aid for epilepsy should always be understood by the family members definitely, because most of the times they are the people who are there, but it's also important for the public to know that, because all of us can encounter suddenly either in the school or in the bus or on the road a person who has epilepsy. We should not get scared, we should always try our best to help the person. So the moment somebody gets a fit, if it is a complex partial seizure, there is no need to disturb the person. The duration of the fit will be for possibly maximum of 1 to 2 minutes, during which the person will be confused. So we have to just make sure if the person is moving here and there, just hold him, see that he doesn't get injured himself. But really the problem comes when the person gets a generalized tonic-clonic seizure. That is, during the fit, the person gets jerking of the limbs and suddenly he may fall onto the ground and he may be jerking in a supine position or in any position. So it's always important that whenever they are jerking, we should not disturb them. And once the fit is over, we should always make sure that we turn them to one side. Because what happens during the fit, there is lot of excessive secretions produced due to the contraction of the, and there is also risk of choking during the contraction. By turning to one side, we prevent the aspiration of the saliva of the person and also the secretions into the lungs. And we should not keep anything in the mouth, because their breathing occurs through the mouth or even through the nose. And if there are any excessive secretions, by turning them to one side, we drain the secretions. And sometimes they may pass urine in the clothes and they bite the tongue. By turning them to one side, you are preventing further injuries. And not only that, we should make sure that they don't get injured. And if any tight clothes are there around the neck, just like make them loose. You can just open the shirt 1 or 2 buttons and make them lie calmly. And following the fit usually will stop in 2 minutes. After that, they may be unconscious for a period of 15 to 30 minutes. So after that, usually they will get up. Though they are dull, they will be fine. But if the person is having a fit continuously, that is if he is seizing for more than 5 minutes, or if he doesn't regain sensorium or not becoming conscious even after 1 hour of the fit, definitely the person should be taken to the hospital. Otherwise, most of the time with these precautions we can manage during the home or anywhere. And other thing is, there are some emergency medicines which are usually given, like keeping a tablet under the tongue or something called a buccal midazolam, or nowadays we are getting the nasal sprays, for which we should be training the family members before the fit so that they can act accordingly during the fit. So the idea of this is to reduce the duration of the fit and also to prevent further fits immediately after the first fit. Because once there is an electrical activity triggered, there is a risk that you may get another fit. So all these should be explained. Then coming to the do's and don'ts, that is, not during the fit, how do we really prevent the fits? We have discussed this many times, in the sense that you should have a good lifestyle habits. That is, you eat on time, sleep on time, sleep for at least for 6 to 8 hours, because significant lack of sleep will cause seizures or will precipitate the seizures, especially for children who are during the exam period. So it's always, we should always tell these children, you study in advance. Just don't sit throughout the night during the exam, because you will get a fit during the exam or just before the exam, and finally you will not end up writing the exam. So you should take the precaution that you finish all your portion before. On that day you sleep well, go coolly and write the exam and come back. And not only that, in addition to this, alcohol is an important precipitating factor for us. So we should avoid taking, those who have epilepsy should avoid taking alcohol, especially in large quantities, because it can precipitate the fit. And other things, so these are the important precautions, and one should, if you are having frequent fits, you should avoid driving and you should avoid definitely swimming. But sometimes those who are well controlled can do you can go for swimming under a supervision. And other question they ask is, can I participate in the sports? Definitely you can participate in the sports if you are well controlled. Those who are having regular seizures, hyperventilation is an important precipitating factor for seizures. And another thing is, mobile phones. Mobile phones by themselves is not a precipitating factor, but definitely means it's always better not to be on for other health reasons, not to be on these phones for a very prolonged period. Even using the computers and all will not precipitate the fit. So But however, whenever you are using a computer, we advise that once you work for half an hour to 1 hour, just take a break of 5 to 10 minutes. Again, you can restart your work. That's how you can learn to manage yourself.